This is a controversial area and probably needs a bit more work. But the GioTag study basically was able to show that if you have somebody who has Afatinib, which is a standard of care first-line treatment for EGFR mutation positive non-small cell lung cancer, particularly the common mutations, and then they become resistant to treatment and have a T790M mutation, that giving those patients osimertinib afterwards, is that the right way to go, or should we be treating with osimertinib up front? It's kind of a bit like that. So the GioTag study was just looking at how long you could keep people on an EGFR TKI for. So what the study showed was that the duration of therapy with the sequential approach was 26 over 27 months, that kind of level, both for the median, for the overall population. Okay, a bit longer for patients who have EGFR deletion 19 versus L858R, a bit longer for patients who don't have brain mets versus having brain metastases, a bit longer for the fit patients, ECOG, or ECOG performance status not 1 versus 2. But for me, the issue really is about whether we should be taking this approach, and this is part of the study, whether they should go straight into osimertinib if it becomes freely available as a first-line agent, which it already is in the States. And I think the data we have now means that you have to try and make a decision about how you're going to do this, because osimertinib gives you about 18 months overall progression-free survival, which is less than the sequential approach. Yet, if you don't use osimertinib up front, might you lose patients who fall away off afatinib and then they won't get second-line treatment? And that probably is linked in some way to how closely you follow up your patients and how in contact you are with your patients. Okay, so I think, to me, if you get somebody in who's pretty fit and pretty alert, and pretty tuned in, you might go for the sequential approach, because then their move on to another therapy, whatever that might be, will be delayed for another period of time. Hence, that may translate into a survival benefit. Okay, we just don't know yet. So there's a lot of questions to be, asked and answered in that setting. But at least we now have some reasonably strong data in quite a big number of patients that sequential approach probably robustly is giving us that kind of time off another therapy, whatever that therapy might be.